Uterine fibroid is not a cancer and it is completely curable condition. Yes, friends, today we'll discuss about uterine fibroid and its non-surgical treatment. Uterine fibroid is a growth in uterus which is commonly seen in all age groups of women, and in many patients it is non-symptomatic, but patients do get symptoms when they are enlarged in size in the form of increased vaginal bleeding, pain, increased frequency of urination, backache, and even pain during sexual intercourse. There are multiple types of uterine fibroids as per their location. Normally, uterus is divided into three layers: endometrium, myometrium, and serosal layer. Depending on the location of fibroid, it is labeled as submucosal, myometrial, and subserosal. If fibroids are small in size, they are curable with medicines as per gynecologist advice. If fibroids is causing significant symptoms in the form of increased bleeding resulting in anemia, that is reduced hemoglobin or weakness, increased pressure symptoms, backache, and even pain during sexual intercourse, then further treatment is required apart from oral medicines. Whenever uterine fibroid is large in size and it is causing significant symptoms, then further treatment in the form of surgery or embolization should be considered. Conventional treatment for uterine fibroid was removal of uterus, that is hysterectomy. Eventually, a newer surgical treatment, that is myomectomy, is developed, which is done through laparoscopy. That means involving minimal incision and minimal blood loss. Furthermore, the non-surgical treatment beyond hysterectomy and myomectomy, that is surgical removal of the fibroid, now the newer treatment in the form of embolization is evolved, where without cutting into the abdomen, we can reduce the size of the fibroid and we can reduce the symptoms of the fibroid. So uterine fibroid embolization is minimally invasive non-surgical treatment where through a small pipe called catheter, small particles are injected into uterine fibroids, which eventually reduce the size of the uterine fibroid, where there is no need of surgical excision, that is surgical removal of the uterine fibroid. So we'll discuss exactly what happens during uterine fibroid embolization. In this process, a small pipe called sheath is introduced in hand or in groin. Through this sheath, another small pipe called catheter is introduced. Small particles called PVA, that is polyvinyl alcohol particles, are injected into the artery supplying uterine fibroid so that the blood supply of the uterine fibroid gets reduced. Once this embolization is done, patient is free to walk, free to work immediately within 6 hours of the procedure. So embolization is minimally invasive non-surgical treatment where there are no surgical incisions, there is least recovery time, and patient can resume her daily activities within 24 hours.